COVID infections are on the rise across the U.S. The CDC says cases have jumped more than 16% over the past week, with at least 30 states reporting increasing cases and hospitalizations. So experts say Connecticut and Massachusetts have seen the steepest rises in new cases. The 7-day average jumped by 117% in Connecticut and 83% in Massachusetts. Yesterday, the governor of Massachusetts ordered hospitals to cut back on elective surgeries to help manage the influx of patients. In Minnesota, dozens of National Guard troops will start helping hospitals overwhelmed with COVID-19 cases as soon as tomorrow morning. More than 400 troops are also being deployed to assist at long-term care facilities across the state. And starting today, people in Denver have to wear masks inside most businesses and venues. The mandate will stay in effect until at least January 2nd. City officials say businesses can get out of the mask mandate if they require employees and customers to show that they are vaccinated. So with more on this, we want to bring in Dr. Susannah Hills. She's a pediatric airways surgeon at the Columbia University College of Physicians and Surgeons. I'm so glad you are joining us today. I think people are going to get really confused by these numbers. Some northern parts of the U.S. are starting to see upticks in caseloads despite having higher vaccination rates. I don't know if it's, we are sort of heading into what is typically flu and cold season. Is that a factor? Can you kind of explain what's going on?
Yeah, Anne-Marie, it is confusing. We've been talking so much about how well we've been doing with vaccinations. We have vaccines available now to children across a large age range of kids. So we've been feeling great about that. And yet here we are at about 93,000 new cases a day. And that's up 25% in the last 2 weeks. There are a few factors at play here. Public health prediction models are estimating that the winter season is clearly affecting our case rate currently. We also still have a huge number of Americans who are not fully vaccinated. And Dr. Fauci's been mentioning this recently as well, but likely unvaccinated folks are the primary driver of our current increase in infections as well. We have right now about 81 million Americans, 60% of our population who have had no dose, or rather who are not fully vaccinated against COVID-19. So those factors are clearly at play here. In addition, we still don't fully understand how durable the vaccine is or how long it will last, but likely there's a significant impact from waning immunity from people who have gotten vaccinated 6, 9, 10 months ago.
The American Academy of Pediatrics is also reporting that they saw a 32% increase in COVID cases among kids. I presume that this is the virus kind of taking the path of least resistance because we know children only really just became eligible for the vaccine?
Yeah, that makes a whole lot of sense to me, Anne-Marie. Yes, it parallels what we're seeing in terms of an increase in cases across all age groups. So along with that general increase in cases, we're seeing an increase in cases in kids. They make up 22% of our population, and right now they're accounting for 25% of our cases. So yeah, we're seeing that as a reflection of what we're seeing more broadly in older people as well, with increases in case numbers and a more vulnerable population because a lesser percentage of our pediatric population is vaccinated at present. Also, we've been seeing recently some schools relaxing some of those requirements. They're feeling good about more kids being vaccinated. They've relaxed some of the mask requirements in some schools across the country. The distancing between children is decreased now compared with last year's requirements in most schools. So those relaxation of protective measures too is likely a contributing factor as well.
I remember sort of last year during the holiday season, some schools kind of extended their holiday breaks in anticipation of students traveling, seeing family members who may expose them to the virus. And I'm reading about schools doing that again this year, some schools. Given the numbers, the rise in cases, are you concerned about what we could see post-holiday season?
For sure. Yeah. I mean, our largest surge, our greatest daily case rate was January 8th of 2021. That was right after last year's holiday season. We had over 300,000 cases a day. So that was clearly our low point in infection, and it was clearly related to the holiday season. And here we are with a significant increase in cases approaching the holiday season. I will say we're not where we were last year. We're at about 93,000 cases compared with about twice that many prior to the holiday season last year. So we're in a slightly better spot. But if we're seeing an increase in cases now, we have this many cases we're dealing with, we have to expect that this year won't be particularly different from last year. We've got indoor gatherings and in the winter season, waning immunity from the vaccines that have already been given. And that whole constellation of factors is a mix for a surge and increase in cases after the holiday season. And when we have increases in cases or surges like this, then the next concern is, well, it's a setup for more mutations and more potential variants.
Mm-hmm. So given all those factors, do you have any advice for people, as they head on into these holiday gatherings? We're always warned not to talk about politics, don't talk about religion. And now we have this other really thorny issue that I know there are people that I know that I don't know well enough to ask them outright, have you been vaccinated? And so, do you have any advice or anything that you think people should keep in mind as they start to plan their holiday gatherings?
Yeah, Emery, there are a couple of things that are really important to do. First of all, I would know what the case rate in your community is. What is the current infection rate? If you're living in Michigan right now, you're in a high transmission area. And so taking extra care and extra precautions is so important. But if you're in an area with a lower transmission rate right now, then maybe you can be a little more flexible. If you're having people in your home, I would strongly recommend knowing what the vaccination status of people you're inviting into your home is. That's really important. If you're going somewhere indoors and you're unsure about other people's vaccination status and you just don't know, then it's probably a good idea, particularly in higher transmission areas, to wear a mask regardless of whether or not you're vaccinated. Even if you're vaccinated, if you don't know if people around you are and you're in a high transmission area, wear a mask anyway. That's really the best way to keep yourself safe. In addition, I'd recommend avoiding larger indoor gatherings and trying to keep smaller settings, avoiding areas of close contact and low ventilation if at all possible. And in particular, if there are people in your family who are higher risk, who have immune deficiencies, who haven't been vaccinated, then those people really should not be in circumstances where there could be exposure.
Mm-hmm. Before I let you go, I just want to ask you a quick question about booster shots. The CDC says that booster shots are the same formulation as the current COVID-19 vaccines. However, Moderna shot is only a half dose. Do we know why that is?
Yeah, so it's interesting. It's not so much the volume of the dose, but the actual amount of the mRNA in the vaccine. So although Moderna has a lower volume dose, it actually has more mRNA in the vaccine. It's got 100 micrograms of DNA in it compared with 30 micrograms in the Pfizer dose. So the amount of actual active ingredient in the Moderna shot is more than the Pfizer. And so we don't know what that really translates to in terms of immune protection. We do have data that came out in JAMA back in August that suggests that there might be a slightly higher boost to the immune system with the Moderna shot. A couple of studies have shown that. It doesn't look like there's really a huge difference between the two, and they're very similar in terms of their efficacy and how much immune response they generate. So both vaccines are great, both boosters are great. And I think the bottom line is that people should take that booster that's available to them and feel comfortable with that if it's an mRNA dose that they're getting.
All right, Dr. Susannah Hills, thank you so much.
Thank you.